Doctors at one of Cape Town's biggest hospitals say they're disappointed by anti-vaxxers, especially in their own fraternity. They say COVID-19 is very real and people are dying every single day. The Western Cape Health Department has given eNCA an exclusive look at the lived reality of patients and healthcare workers at Groote Schuur Hospital.
Gasping for breath and fighting for their lives. This is what doctors like Professor Mtobeko Ntusi want people, like those who demonstrated outside the hospital last week, to see.
I really found the actions of the protesters to be most disdainful, distasteful, and deeply, deeply disrespectful, because since early 2020, the staff of this hospital have been working tirelessly to try and provide quality services and to save the lives of many thousands of people infected with COVID-19.
300 people are currently hospitalized in 18 wards at Groote Schuur. 46 of them are being treated in the 8 ICU wards. These patients are severely sick. Many have bad pneumonia, complicated by multi-organ failure.
The vast majority of patients that we're seeing in the hospital are people who are unvaccinated. And this is what makes the protest feel like a real kick in the teeth for our staff, who are making sacrifices to save the lives of these very sick individuals who have not taken up the opportunity to receive the vaccine.
And it's no longer just elderly patients who are occupying the 3,600 COVID-19 beds across both private and public hospitals in the province.
Because we have relatively high numbers of uptake of the vaccine amongst people over the age of 60, we're starting to see a lot of young people, relatively healthy, without comorbidities, who have not taken up the vaccine, ending up in hospital severely ill. And these are the patients who fill up most of our wards.
1.6 million people in this province have now received at least one dose of the vaccine, and medical staff here say it's making all the difference.
Even a single dose of the vaccine confers significant protection, and in fact we've got incredibly small number of people who've received even a single dose who end up, when they get symptoms, needing to be hospitalized. And in the main, they tend to do very well. And it's the ones who have not received the vaccine who have the most severe symptoms and end up needing to be incubated and taken to ICU.
Before being vaccinated, 1,300 healthcare workers here were infected with COVID-19. Now, breakthrough infections result in only mild cases of the disease.
The impact of this kind of work has been enormous. It has resulted in very high rates of burnout, mental health issues among staff, but also people are working outside of their comfort zones and seeing something that we are not accustomed to. People who are severely ill, dying in large numbers, and so a huge degree of moral trauma and moral injury from the kind of work that we are doing. And then they have to return home. They have the anxiety around how they protect and limit the infection to their loved ones.
As the peak of the third wave starts to drop, health authorities say the worst is not over.
For another week or two, there will still be significant pressure on our hospitals, and we hope that after that, the pressure will start easing off a little bit as people are discharged from hospital. So that's all good news. However, we still remain prepared, and there will still be people admitted in hospital even as we come off the peak of this third wave.
Those still in doubt about the efficacy of the vaccine, including some within the medical fraternity, need only step inside these wards to see the devastating impact the virus is having.
This is an area where the science have moved so quickly and the evidence is compelling that vaccines do save lives, and of all the public health measures we have at our disposal to reduce the impact of COVID-19 on our society, the vaccine is by far the most powerful. And so to have colleagues dispel the science that is validated and accepted world over is most disappointing.
Lindsay Dentlinger, Cape Town.